Well, I guess the big question at this point is, and I want to know, how is the AI going to wipe us out? Because obviously that's going to happen. This is Generation Health. Every week we bring you news, cutting-edge research, and time-tested best practices to help you live better, longer. Sitting across from me, Joey DiMatteo, pharmacist, board-certified clinical nutritionist. Good morning, sir.
Good morning, Tyler. How are you?
I'm fantastic. And to my right is Dante DiMatteo, registered pharmacist, certified strength and conditioning specialist. What's up, man?
Nothing much. Good to be here with you guys.
Yeah. My name is Tyler Andrews, and I am the host. This week on today's show, we're going to be talking about artificial intelligence, which actually does relate to health. It might not sound like it, but it does. We're going to talk about AI and bedside manner. We're going to talk about AI tools to predict cancer, and most relevant to us, AI and pharmaceuticals. There's a whole lot of fascinating news around that. But because we're talking about this specific topic, I have to know, what's your favorite rogue AI? And I'm thinking movies here, movies, books, but movies are the ones that have popularized it. What's your favorite rogue AI?
For me, it's essentially the first one that I've ever seen would be Terminator. Because as a kid, I didn't really understand. I saw it pretty young, like the TV cut version. I actually watched it with my mom, like again the TV version. Fast forward to the commercials, but it wasn't like an important part of the plot to me. It was just the bad guy was Arnold, and that's all that mattered. But looking back, when you think about it, I mean, for a movie that was made in 1984 to be dealing with that, and it's not that far-fetched from what a lot of smart people think could occur with AI.
Well, especially with the later
amazing
movies.
Yeah, and how they kept going with it. But even just the basic 1984 premise was,
Pop quiz. Don't look at your notes. What's the name of the actual AI?
Skynet.
Thank you.
Yeah. I remember that more from Terminator 2, but yes.
I may have lost a trivia night because I couldn't remember Skynet.
Oh, wow. That surprises me.
The wife and I destroy everyone in trivia. So every once in a while we'll take a date night and we'll go to one of the restaurants in town that does that. And we were crushing big tables of 5 and 6 people, just the two of us. And it was about what's the AI in Terminator. And I was like,
you knew it. It was just kind of one of those
I can see the logo. I can draw the logo. I just couldn't come up with the name.
Oh, yeah, that's
anyway,
funny.
Skynet. Good job.
I would have won that thing. Well, I don't know what the other questions.
Skynet.
Yeah. Dante, do you fear artificial intelligence?
A little bit, I would say, based on these two characters that I'll mention. They're just like the first two that I thought of.
Yeah.
And they were both from one's from a show, one's from a movie that my roommates and I, that we all watched around the same time, like 2015, 2016, we were watching all the shows, all the movies. And so if they end up watching this, they'll like these two. One is from Ex Machina.
Yep.
Ava, which I had to look up her name. Really, I think no more than just that. Of course, some of us had a crush on her.
She's not really a her. She's a robot. Like, that's the whole point.
Yeah, I think that's the first robot.
Definitely like a her.
Yeah,
that's the first robot. Like I think we had a crush on. From an AI perspective. And then the other one would be Bernard Lowe from Westworld. Just the first season.
Yeah.
I think we said none of us really stuck with it. None of the roommates really stuck with it after that, other than one or two. But I think his big surprise was that, of course, you thought he was real the whole time, and then it turned out he was a robot.
Yeah, that was good.
We were devastated, and he was the man.
Have you watched the 70s version? I didn't even think about that, because that was the first one I remember. Was the original Westworld movie with Yul Brynner as the Man in Black, and he's the rogue AI that is terrorizing everybody. Really good. You should check that out sometime. Especially when you see it compared to the modern show and see how they changed it. The first episode of that TV show, they're clearly playing with people who know the old movie, and it was really fun. Anyway.
Did you say the movie was better? Or just different?
It's different. It's more concise. It's a single well-told story.
Sure.
And it's all cat and mouse. It's Yul Brynner chasing around a guy trying to kill him, which Yul Brynner probably could have done. So it's good.
What
It's
an
good.
unreal. I mean, that's just like the most unreal concept, Westworld.
Yeah.
I mean,
It is.
it's absurd. We definitely love that.
But it's not too far from reality. People wanting to do extreme escapism.
But yeah.
Yeah, and you get into that whole thing where it's like extremely wealthy people that do it and all
Yeah.
that, and then that's where you get into all that stuff. It's
Yeah.
interesting.
It's good stuff. Anyway, this is very related. I'll do mine quickly here. My favorite by far is Roy Batty from Blade Runner, because that's my favorite movie of all time. But the one that I immediately thought of, and I think a lot of our listeners will remember, is the HAL 9000 from 2001, A Space Odyssey.
Oh, yeah.
Wow.
I've seen that forever.
I
Wow.
can't do that, Dave. That's the
Wow,
original
yeah,
Rogue
I totally
AI,
forgot
think.
about that one.
Yeah, good stuff. Well, hopefully none of that actually happens, because if it does, it's going to be very disappointing for the rest of us. But
Very disappointing.
yeah, we've got as we're all dead. There's a bunch of new research, a bunch of new papers that have come out detailing ways that artificial intelligence, things like ChatGPT and all that stuff, are interacting with medical research and dealing with patients and all those things. One of these groundbreaking new AI can detect cancer earlier. This is from the New York Post. Doctors and scientists in the UK have reached a major breakthrough in fast-tracking cancer detection, all with the help of AI. The new artificially intelligent algorithm in development since 2020 has the means to determine whether or not abnormal growths found on CT scans are cancerous, The Guardian has reported. Lungs of 500 patients were analyzed in a published study on the impressive technology. Quote, according to these initial results, our model appears to identify cancerous large lung nodules accurately, unquote, said the researcher Dr. Benjamin Hunter, a clinical oncology registrar at the Royal Marsden National Health Service. Quote, next we plan to test the technology on patients with large lung nodules in clinic to see if it can accurately predict the risk of lung cancer. If successes continue, this will also streamline the time it takes doctors to make critical decisions on proceeding with treatment, particularly with growths that are medium risk, according to the outlet. This, and then later on, I saw in another place where they were talking about this same study that doctors doing this research, looking at the large nodules in lungs, whatever it was, that their accuracy, an accuracy of 1 would be a perfect prediction every single time. And they were saying that 0.5 is random, like just
50-50.
flipping a coin. Right, exactly. And that trained doctors had an accuracy of 0.67. So better than random, but not exactly great.
They were using the Brock score for that.
Right.
Yeah.
But that this AI, once it was trained, was able to detect it with 0.87 accuracy. So 87% correct, I guess, which that's incredible. That's amazing. So this is specifically about lung cancer. Why? I don't fully know what's the deal with large lung nodules and stuff. It was saying that some of them are cancerous and some are not.
Yeah, we could touch on some of that. Don't want to go too deep. But yeah,
Right.
I think the key thing in the question you're asking is, well, this was done in the UK. So the data point that I pulled just kind of stuck to the UK to stick, in this article. But 60% of lung cancers that are identified are in stage 3 or 4. Mm-hmm. So that essentially means it's spread to some extent. So
okay.
that's what's very critical about this, is that I don't know what the term should be, but they didn't go for an easy cancer to detect or to treat. And they went for one that has a lot of ambiguity because, again, what you've already mentioned, that small lung nodules are very common. Most are benign. So essentially 1 out of every 500 CT scans done for whatever reason show pulmonary nodules. And 50% of smokers over 50 have one.
That
and
makes
again,
sense.
they're mostly, when they're small, they're very common and they're mostly benign. But that's, again, where the complication becomes, you don't want to overtreat something
that's benign.
Yes, but something as serious as lung cancer, because you're either radiating it, you're giving chemotherapy medications, you're giving heavy duty things, you're even biopsying it, potentially even something like that, are all very invasive, all very quote unquote harsh treatments. So over treatment is a big fear here, but obviously under treatment,
That's a
is
problem
fatal.
too. Yeah.
So
So they're saying that by the time doctors are certain that, oh yeah, this is definitely cancerous, that it's you said stage 3 and 4 a lot of times.
yes.
And so something like this can detect it earlier and more accurately predict what
Yeah.
actually needs treatment.
And again, the exact specifics is beyond the scope of this, but I still wanted to know exactly how, why this AI or how it actually worked. And just in a general sense, they use what's called radiomics.
Okay.
So essentially they fed into the AI a huge number of images.
Right.
And labeled them as cancerous or not, their size, their shape, do they have ridges, all those things. And they fed it all that data so that's how it's looking at a new one and kind of lining up what they believe it to be based on all that data. So there's different scores that doctors can use. They're obviously very well trained.
Yeah.
But I think when you're looking at something that like this, I do totally now, even just with that broad brush description, understand how it works and understand how it could be beneficial.
Right.
It's not determining treatment. It's still, essentially just another tool for the physician to, make their decision and to choose treatment. But in terms of determining the likelihood of it being cancerous, that does totally make sense to me in that broad stroke.
So I found out about this stuff because it's a very long story, but the short version is I was selling a record to a guy and just chit-chatting, and he said he works in data science in the medical field, and his job is in a dermatology, I believe it was, teaching AI to recognize potentially cancerous like moles or something like that.
Yeah.
And it's the same sort of thing.
I was going to say, it sounds just like that.
It's just feeding it thousands and thousands of images and helping the AI to know this one was cancerous, this one wasn't. Yeah. And then now it feeds it a new one and you ask the AI, hey, is it or not? And it's able to spit out a relatively accurate answer.
Yes.
Fascinating stuff. And a really cool application for something like that. When it comes to cancer, you mentioned radiology and all of that. Is there anything else that for our purposes are worth talking about in terms of touching on for pharmacology?
Yeah, I think maybe it would be beneficial, just to, wrap up lung cancer this way and potentially
since
open
we're
it
here.
up as since we're here. Yeah. So, like Joey mentioned, it is unfortunately one of the forms of cancers that are seemingly caught later in its development. And to sort of piggyback on that, the average age at diagnosis is around 70 years old. So again, it's later in life. It's typically later in staging and therefore, tougher to treat oftentimes.
Yeah.
And so the pharmacologic treatments will then depend on the specific form that you're dealing with, and then also sort of the staging system that's used for, across the board for different cancers. And as always with different forms, surgical resection can be an option, chemotherapy, of course, radiation, and then sort of the gold standard, depending on where you fall in the staging system, combination or multimodal therapy is used.
Right.
And so as far as classifying lung cancer, broadly speaking, you're looking at non-small cell lung cancer and small cell lung cancer, I think, are the two biggest distinguishing, branches of it. So the non-small cell form is arguably the most common. There are additional subtypes from there, but we'll, stay pretty broad here in this conversation.
Yeah.
And typically you'll see drugs that are in the platinum-based family. So cisplatin, carboplatin, those medications that,
Platin?
Yes.
Not platinum.
So they're technically platinum-based.
Really?
But then they have platin.
Like
nomenclature.
The actual
Yes.
metal?
Yes. So that's, I think it resembles the actual molecular structure is of platinum, derivation or whatever. But
fascinating.
And those medications work basically just by, and a lot of these work this way, trying to kill cells,
right.
To induce cell death by messing somewhere with how DNA repairs itself, how DNA is made, DNA synthesis. I'll just list some of the classes. And again, just more or less to say, hey, these might resonate with a family member who has lung cancer, or other forms of cancer, because these drugs, these chemotherapeutics, are not necessarily specific to lung cancer.
Sure.
So there are vinca alkaloids that are used, anti-metabolites, taxanes, and then there are some new immunotherapy monoclonal antibodies that are used these days in maybe I would say later developing lung cancers, like later staging. Opdivo and Yervoy, excuse me, I think it's Yervoy or Uvozy, whatever. Those are two of the bigger ones for non-small cell lung cancer. And then to gloss over small cell as well, this is typically viewed as the more aggressive form of lung cancer. There's generally no role for surgical resection in these cases because it's rapidly spreading. And so you'll see, more aggressive radiation, more aggressive chemotherapy to start. And to shed light on the severity and the magnitude of that one, there's roughly a 5% 5-year survival if diagnosed with small cell. So,
wow.
Definitely a very clear link here to smoking as well. And again, treatment is predicated on whether it's very limited involvement throughout the body or extensive staging where it's already spread more aggressively.
So the first thing people should do is stop smoking, right?
Tough, but yes, definitely not helpful here to continue to smoke, unfortunately.
All right. Well, very cool. So this is great news that we are using AI to help identify these things faster.
I was going to say, so to kind of sum that up, it's earlier detection potentially just kind of gets the ball rolling for treatment is kind of the way I interpreted it. And, because even if it is suspected, if cancer is suspected, there's so many additional lines of testing that need done to confirm that. Yeah. And if these models are so effectively predicting this, then it's like, you might be able to skip some of those intermediary steps.
It's one of them to get the one type of score, the Herter score. You have to use a radio tracer. So that's an entirely separate procedure. And, you can, they're not at the point yet, but obviously like Dante's saying, if you get there where you can really trust the accuracy in large scale trials moving forward, then that's where the streamlining comes in. Definitely.
So is this, realistically, are we looking at a situation where in 10, 20, 30 years, we just have a routine scan of our lungs done and the AI can relatively accurately say, hey, you should go have some further testing because this is a real problem here.
Yeah.
And theoretically.
And I think I never want to come across as being potentially on the side of being against evidence-based medicine. That's crazy. Obviously, the good that comes with evidence-based medicine outweighs any potential bad. But I think the more you get into where decisions are taken out of doctors and not just doctors' hands, but a doctor-patient decision together,
right?
That's where it gets a little scary for me. Because then if you say, hey, sorry, Mrs. Jones, I put it through the test, and every other doctor is going to say you have to do this now and not maybe take into other potential issues, quality of life, how old is this person, et cetera. What other, what are their feelings on it? I always just get a little... I don't know. So anything that's going to push us further away from a doctor decision or a doctor-patient decision, it's not even close to being there. If that's where we go, you kind of brought it up.
Right.
That's what I had in my little concern section is something like that,
See, the AI is a threat.
As far like the general theme with what we're going to talk about for the rest of this conversation kind of is basically the concerns that Joey brings up there.
Yeah.
You know what I mean? Is that even the critiques of physicians looking at these studies say those same things. You know what I mean? There's ultimately in whatever fashion the machine learning or deep learning or whatever's being used, there's going to be no way to substitute the actual clinical decision-making process that goes between patient and physician provider.
Right.
So it's tough to. It's easy because we're going to see a lot of compelling studies, a lot of compelling things that put more eggs in the AI basket, which is great, but it has to be viewed as no more than a very promising tool, because it is easy to go too far.
Yeah.
I forget the term, but there's the deep learning AI, and there's a more passive AI that just uses what's been entered into it.
Yes.
And the deep learning AI is the one that can be a little more scientifically like incredible sound.
It's more human like.
Yeah.
Right.
But if it starts deep learning and starts maybe using some of its own decision making, like, well, this is as long and I don't care about anything else,
right.
or how bad these chemo treatments will be. My job is to fix his lungs. So I'm upping this percentage. I know that's getting a little out there, but those are the things that you do worry about if it goes into this deep learning where it's starting to make human-like decisions and,
And it should be noted for our purposes, I'm sure there's some data scientists out there that are screaming at their radios right now. We're saying AI in the colloquial sense. There are variations on all of this. There's the large language models, there's the deep learning stuff, there's all those variations, and they're not all the same, and they all operate very differently, and many people would argue that they're not even AI, but for our purposes.
Something as simple as whenever you're typing into Google and it starts, recommending the rest of your search query, like even that's
predictive text.
Considered AI. So a lot of it is, seemingly pretty mild,
But to this kid who grew up in the 80s and 90s, it's all science fiction, and it blows my mind every time.
Yeah.
All right, well, let's talk about bedside manner. This cracks me up. This makes me so happy. Speaking of ChatGPT appears, this is from The Guardian, appears to have a better bedside manner than some doctors. At least when their written advice is rated for quality and empathy, a study has shown. The findings highlight the potential for AI assistants to play a role in medicine, according to the authors of the work, who suggest such agents could help draft doctors' communications with patients. However, others noted that the findings do not mean ChatGPT is actually a better doctor and cautioned against delegating clinical responsibility, given that the chatbot has a tendency to produce, air quotes, facts that are untrue. The study, published in the journal JAMA International Medicine, used the data from Reddit's Ask Doctors forum. I always go to Reddit for my medical advice, and I definitely do not suggest, no, you should not go to Reddit for medical advice. But there is apparently an Ask Doctors forum.
Wow, I did not know that.
In which members can post medical questions that are answered by verified healthcare professionals. The team randomly sampled 195 exchanges from Ask Docs, where a verified doctor responded to a public question. The original questions were then posed to the AI language model, ChatGPT, which was asked to respond. A panel of 3 licensed healthcare professionals who did not know whether the response came from a human or from ChatGPT rated the answers for quality and empathy. Overall, the panel preferred ChatGPT's responses to those given by a human 79% of the time. ChatGPT responses were also rated good or very good quality 79% of the time, compared with the 22% of the doctor's responses, and 45% of ChatGPT's answers were rated empathetic or very empathetic, compared with just 5% of doctors' replies. So, I mean, this is analyzing an online message board. So let's be a little realistic here.
Mm-hmm.
How well can you actually gauge someone's bedside manner based on a message board?
Oh, man. Probably not very well.
Okay.
Yeah.
That makes me feel a little better. But it is fascinating, right?
It is.
Yeah, I do think, and I guess the way I took this is being in pharmacy, it's not the same scale as, God forbid, being an oncologist and you're, out there giving these potentially terrible prognoses and discussing these, really difficult treatment options. So, but in a much milder sense, they do get those multiple calls a day where, but I know this issue kind of pushes my button, or I know potentially even this person kind of does.
Yep.
And I'll have to, even talk to myself before I grab the phone or whatever and say, hey, just watch your tone, stick with the niceties.
Yeah.
I don't think that, going through, and if at some point it's a quick thing to do, a doctor putting his text into a ChatGPT and it prettying it up to some extent and adding some niceties for them to read. I mean, that's probably in the extreme, but I think that there are some things that can be gleaned potentially from how the ChatGPT uses empathy and how it communicates that. And if you could kind of tack that on, and it's editable by the doctor or whatever, or just even as a, just a quick refresher before I make the call. This is kind of what I'm going to say. Let me just punch it in here. Okay, there's at least some niceties I can surround it with, or some empathy, or whatever the case may be. And plus, we're going to a text message society. I mean, I still don't know at what point you get, God forbid, a cancer diagnosis from a text message, but we're going to, everybody feels more comfortable just messaging and texting and, doing all that. So if there is a way to kind of punch in your response, I don't know. I think it was interesting. I'm not saying like that's where we need to go, but I do think there's some good things that could be gleaned from it potentially.
Yeah.
I took it kind of that way, I guess.
Yeah. I jumped right to more customer service as well. As opposed to bedside manner. You know what I mean? Because this is not an example of bedside manner, really.
Well said,
but as far as like like my head went exactly the same way. Like we almost need this in like training of new pharmacists, training of new techs. Like here are some examples of when Mr. Jones calls about that one question that you hate every time. Here's a template of how we answer this question.
Right.
Period.
Yeah.
Like there's a way to leverage these sorts of things. But right, as far as a replacement or something that you would have time to do before you got to have a conversation at the bedside, theoretically, like there's no way. Like there's no way. I mean, this is just it's part of the story. But go ahead.
I remember something I was reading, I think it was was talking about how this is not, first of all, it's not making diagnoses. If you're going to to ChatGPT for it's kind of like the typing your symptoms into Google and seeing what you get back. Oh, I have cancer. I have the sniffles. Must be cancer. Like that's kind of what you should expect to some degree. You need to talk to a human, but having the ability to see what an empathetic response would look like,
right,
as opposed to facts and figures. I mean, I've always made the joke about my CPA maybe not having the best personality, but that's okay because he's a CPA. I don't hire him for his personality. The same is probably true for a lot of doctors and things like that, but it would be really useful for training purposes to go, hey, if you just add this one little statement on the front here, like, I'm really sorry you're in pain, that would help a lot to get people to receive what it is you're saying and then take action on that.
Yeah.
That's fascinating. I mean, it said that they're not better than doctors, but those stats are good, but you're saying, or we're saying, it's not the same thing, right? Because you're making instantaneous decisions in a conversation and things like that.
Yep.
Okay. How could this be helpful beyond training? Is there some way that you guys could see this being useful? My first thought was like an AI customer service bot that could, if somebody has a question about taking their medicine, that they could type it into the pharmacy's AI and it would kick back an answer, and then they could elevate it to a human. Like, is that a foreseeable future? Is that something that could take some load off of you guys?
I guess where I took it was kind of in the text messaging type of thing.
Right.
Where if, let's just say whatever, you have a secretary or an assistant that takes a phone call, you generally know what it's about. You generally know, or you're a doctor and you've got these test results and you're about to call this person with these test results, and maybe there's some scary news in there or some unknown news. How do you frame that?
Yeah.
That's not robotic, or how do you not allow your human, like, boy, this person asks me this question every month, or this patient calls me every other day asking about the test results.
Just taken my advice a month ago, this wouldn't be a problem.
Yeah, so I guess that's where I took it.
Yeah.
That it could be a human assistant in terms of how you frame certain answers, and that it removes some of your own bias from the framing of the answer, or the ending, or how you stop it, or how you initiate it, whatever the case may be.
Yeah. Very cool. Any other thoughts?
Yeah. Not necessarily in line with that, but I just was scanning through some of the the critiques that I had with the study, not to like just totally.
Oh no,
not
trash
to like
the study.
totally
Go for
trash it because we already like.
It's still a fun headline.
I think we vaguely, I mean, gave our input, and where we thought this could be useful. But there were some specifics here mentioned by other healthcare professionals that I thought were interesting. So, firstly, it technically was not a randomized trial, although the responses were blinded. So there's still always that caveat that there's more to be looked at here, as far as information that you can tangibly move forward with.
Right.
Whatever. The next one would be that the questions were actually only evaluated by licensed medical professionals. And so it wasn't, from my understanding, it wasn't actually patients that were giving the feedback. So that's a whole other side of it, because arguably, you would.
It wasn't the person receiving the news going, "Hey, response A was much nicer than response B."
Mm-hmm. Yeah, and that's still nitpicking, but worth mentioning. The questions came from a very small sample. I mean, there's
195.
There's so many other instances of like another pool of questions could have been very useful beyond just Reddit. So again, that's another nitpicky kind of thing. In the actual machine learning deep learning, there was no actual input of like medical history or context of the person or
That's a good point.
demographics. Like there's nothing in there. So you're getting these like generic empathetic messages still.
Right.
Really.
And I didn't even think about that.
Yeah.
And it's going to be medicine, air quotes, medicine, using the AI based on the majority.
Yep.
So if there's something that affects a majority differently than a minority, like sickle cell anemia jumps to mind, it's going to be answering based on the majority of the cases and not looking at edge cases that might be really obvious to an actual human doctor.
Exactly. And so along with that, empathy could almost be misconstrued, like could just be totally misconstrued given someone's like ability, like language or culture or whatever.
So phony or something. Yeah.
Right. Like there's just different different backgrounds, different ethnicities, all of those things, different, financial situation, all those things matter with a given person and how you have to, interact with them on a patient provider level.
Yeah.
And then these large language models, I think they're notoriously known for having these super long, grandiose answers.
Yeah.
And so it was, coincidentally, the ones that had the highest ratings of quality were the longest responses. So there's a chance that there was some bias there that, okay, you see this longer response. It's more well thought out. It's obviously more empathetic. This is there are some things like that just make you wonder.
Right.
If you're, again, looking to take this too far to say, oh, I'm going to replace everything I say with what I type into my computer.
I'm going to take my phone with me to the meeting, and before I respond, I'm going to type in the question to ChatGPT, and then I'll just read it back as a script.
Yep. And then beyond this study, really, because these answers were all screened and they were all sort of evaluated independently after the fact. These large language models, they're also known to, I've seen these words thrown out there. They're known to invent answers, and they have the potential to hallucinate.
Wow.
And so it's like because they're actively learning. Again, I don't know two things about this stuff beyond a very surface level amount of research. The quality of some of the answers definitely would be in question if these models are way ahead of themselves.
Right.
They just they're essentially making things up.
They get a little out over their skis.
They do.
Yeah.
They do.
When they go wrong, they go really wrong fast.
I just thought that the terms, I mean, you start talking about artificial intelligence, and that's already pretty buzzwordish, and movies and shows and music, all this stuff. And then you start hearing that they have the potential to hallucinate and they invent answers. And
it's like, so
Like, what in the world?
So don't replace your doctor quite yet. Okay, cool. Let's take it to a little more specific, industry specific place. AI is about to remake the pharmaceutical industry. This one's from Politico. And guys, everybody knows how much we love these overblown headlines, but this one seems legit. The next blockbuster drug could be invented by artificial intelligence. Medicines designed by AI for conditions including lymph cancers, inflammatory diseases, and motor neuron diseases are reaching trials in humans. For many, it's just a matter of time before they're sitting on the shelf in a pharmacy. If successful, AI promises nothing less than a revolution for the pharmaceutical industry. It could dramatically reduce the time it takes to develop new medicine, as well as help identify new drug molecules that have so far eluded scientists. Drug makers would pocket billions with a B, but it would also mean patients could have access to more new innovative drugs at a pace not seen before. The premise for using AI in drug discovery and development is pretty straightforward. Use algorithms to trawl through vast troves of data, including the structures of chemical compounds, animal studies, and information from patients to help identify what a future drug needs to target it in the human body. With multiple AI-designed drugs now being tested in humans, it could soon be crunch time. Okay, now this is a medical company name that I don't know. Exscientia? Do you guys know that one? You don't know that one? Okay. Exscientia, we're going to go with that, was first out of the blocks in 2020 with a drug it hoped could treat obsessive-compulsive disorder. While that study was discontinued after failing to reach expedited criteria, the company now has a cancer drug and one for inflammatory diseases in clinical trials. And it's not the only one. Schrödinger has a potential lymphoma drug in clinical trials. In Silico has a drug to treat idiopathic pulmonary fibrosis that is expected to enter phase 2 trials this year. And Verge Genomics is trialing a novel therapeutic for amyotrophic lateral sclerosis, or ALS. Is that what that stands for?
Yeah.
In some cases, such as with the Verge's ALS drug, the drug development process itself has been thrown on its head. Traditionally, drugs are tested in animals before moving to humans. Instead, Verge's platform uses human data and human models in the discovery and development phase, a process that they believe provides more insightful findings than animal models. All right, that was a lot. So let me back up here. What is the traditional development process for these novel drugs?
Yeah, so I'm trying to just going to hit it in a more general sense. This is something if you really want to look into, you could read, in a quick article. But
sure.
So I'll kind of start with something I thought was interesting, then kind of go into it. But so in Toronto, I didn't catch the year, but it was in this recent article. In only 30 days, an AI-powered database was able to develop a drug that treated a hepatocellular carcinoma. Okay, so that's basically a primary liver cancer, that means a cancer that starts in the liver.
Yeah.
It created a novel hit molecule. And one way that a lot of drugs work is you can kind of think of them like a lock and a key.
Yeah.
So why does, a certain neurotransmitter in our brain do a certain thing when it hits a receptor? Because it's a lock and a key. So you have drugs that mimic it in a certain way. Maybe you make a drug that can stay on that receptor longer. Like benzodiazepines, they're a drug that works on GABA but doesn't mimic GABA. It goes to the side of the GABA receptor, changes the way the key is or the lock is,
right,
and more keys can go into it.
Got
it. So when you look at it that way, if you're trying to create a drug and you have a human trying to use a computer or trying to use, literally, drawn, going back, these molecules and trying to figure out how the lock and key would work, because you're basing it off of, well, the GABA receptor looks like this, so we'll make a molecule that looks kind of like similar to it in these portions because we found that it binds here, etc. So if you have a tool that can figure out potentially lock and keys, again, I'm really simplifying it here, but I think for our purposes, that's why I do think this is pretty amazing.
Yeah.
And it has nothing to do with, well, if it's an AI created drug, that it's going to be this crazy mechanism and it's going to be not tested and it's going to be bad. Like, I don't want to go into this, but the controversy of the shot, that's become so controversial is because it was a novel It was a completely novel mechanism of action, the way it worked in the body. And it wasn't tested for very long. That's why it's controversial. It's not because it was made by AI. So that's something I want to touch on too. But basically, a drug goes through a couple stages. Is drug discovery. What are they even aiming to do? Sometimes it's discovered by accident. Penicillin was discovered by accident.
Right.
Even something like Viagra was being used as a blood pressure drug, and you're gathering information, and there's this information that they're finding.
Yeah.
So, I mean, some things happen in that way. They're used for they're being looked at for completely different mechanisms, and they end up being found that way. Those are rarities. It's becoming more and more targeted as computers and scientists become more and more sophisticated, and obviously AI is just the next step to that. So there's a drug discovery. You're just trying to figure out what you're even trying to treat and what your approach is to it. Then preclinically, you're really gathering information that you maybe well, this could be toxic for this reason, and you're trying to gather all that type of information. And then it goes to the clinical phases.
Right.
So before it ever goes into a body or before it's really advertised, that's kind of like what they'd call a pipeline. A drug, when you hear of a drug company's pipeline, that's what it is. They're discovery preclinical things that they're believing can work for certain things, but they're still figuring out before they want to move on to humans.
Okay, so the clinical is when they move into humans.
Exactly.
Okay.
Preclinical is that phase right before. Maybe it's animal testing. Maybe it's more and more so these human models. And maybe it's also just, again, trying to compare it to other things and make sure that when they enter into these clinical trials that it's not, obviously a nightmare. And then it goes into the clinical and the FDA testing and all that. But I think for these purposes, again, it's about that, the AI is involved in the initial phase.
Right.
How it acts in the body really has no basis on whether it was produced by AI or whether it was produced by some accident or whatever the case may be. To me, once it's in the clinical stage, it doesn't matter what the source was, but this can streamline that and expedite that so quickly.
Got it. Okay. Because it is concerning. Like, we're just going to trust this robot to come up with the next thing that we're going to inject into everybody's arm and just trust that it's going to do a good job and there are no problems. But the model said it should work.
Only expedite that beginning phase.
Okay.
Yeah,
and that's what we're talking about here. We're not talking about in place of actual human testing or gathering that kind of data.
You're shortening the discovery, you're shortening the preclinical development phases. Those very costly phases where a lot of times, honestly, things get thrown away. Yeah. Where a company spends millions, if not billions of dollars developing, and for whatever reason, a lot of times human or animal toxicities, it becomes a worthless molecule.
Right.
So down line, you could argue that then the efficiency should hopefully bring costs down over time because they're not spending 6 years and throwing away 3/4 of the things that they're trying to make. That with these sophisticated models, they're treating potentially deadly diseases quicker, and they're also not having to throw away some percentage of what they're doing theoretically.
Humans are much more complex than any AI model can actually create at the moment, and we behave differently and we have different habits and all the rest. What are the actual testing mechanisms in place? We've talked about this before, but it bears mentioning, especially when we're talking about something like this. How are these drugs tested?
Yeah, and I think the easiest way to answer that is to sort of echo what Joey said, echo what the article says itself, is that simply these medications that were developed in the early stages through AI, they have to pass through the same regulatory hoops as the traditionally, so to speak, developed medications. So that's the key. That's sort of the key in that regard. So the other thing that I found interesting was that as the improvements in AI continue, there was also new legislation that passed in regards to the FDA, which typically requires animal testing to be done. Now the FDA has the option to. They're not going to do this with every medication, every developed drug, but they have the ability to say, "Hey, we don't need the animal testing. You can jump to the phase 1. You can jump to the phase where we start to look at this drug in healthy subjects where that's tested." Now, that's not like a direct connection to this. It's not like, yeah, we have this new act in place and AI is replacing animals testing.
Right.
That's not what it's saying. But I just think that the fact that these two things are sort of running parallel is very interesting, because they're now the developers of these, the developers of these platforms that are able to begin to, I don't know, sift through millions of molecules. They have human models in sort of human, I don't know what the best word for it is, but human scenarios where they are getting information that's even more viable, they claim, than what they can, achieve in animal testing.
Wow.
Specifically. And so it's like, hey, if this helps even expedite that as well, and we have to, and we have the ability to use less animals, then that's another example that this, I think, is a net, a net positive potentially. So although it's, most of its utility is, like Joey said, in the foundational research, it's in the preclinical testing, there is still this, overlap into now, well, hey, we have this model and we have this new technology that was using these models that we can sort of mimic what we see and how this molecule worked in animals.
Yeah.
And so it's a lot of crazy stuff happening, I think, at the same time.
Yeah, those are almost kind of the way I took them, kind of two different things.
Yeah.
Like there's the AI development of the drug, and then there's, in my mind anyway, there's a model that they use of the human body.
Yeah.
That, you know what I mean? That then it's plugged into to see how it's going to, have its effectiveness, but also maybe, not cause toxicity to the kidney as it's processed, those kind of things. So I think that, to me, I kind of separated those things, that yes, they're both on this article together, and they're going to work together, like Dante's saying, but that they're also kind of two separate things. That AI is not necessarily saying that's why we're skipping animals and and allowing quicker human testing. It's as much, to me, the model of the human that they're improving upon to get all the systems correct and to kind of follow it from mouth to waste, etc.
Right.
Because that's where a lot of problems come in, are those toxicities to other organs and what it's doing to the to the rest of your body.
I mean, kind of like chemotherapy works really great at killing cancer, but it also has this real problem with killing all the other things too.
And then obviously you get really deep, because if that was treating a cold, it wouldn't be on the market.
Right.
But because it's treating lung cancer, it's on the market, and you deal with different things. So then you've always got to balance that too.
Wow.
That's where there's no black or white answer to how much downside is allowed, because it's that scale.
Yeah. That's interesting. That's fascinating. So it mentioned half a dozen drugs that are currently in trials. Did you guys do you know about any of those, or any of them standing out to you as interesting?
I don't know about any of them, but to me, ALS, known as Lou Gehrig's disease, is just such a hideous disease.
Yeah.
That's really found nothing that stops the progression. It's essentially is, terminal. So I can't say I did a deep dive into that drug and where exactly it stands. But to me, when I was just talking about the scale of importance, or the scale of, that to me really stood out, that I was happy to see that, because it's just beyond a hideous disease.
That's a really good point. And the article mentioned that, I think you said it too, that you could specifically target a disease and go find a thing that does this. Find a key for this lock. Yeah. That would be really cool to be able to make some headway on some of these diseases that have currently no real treatment.
Yeah. And then again, that's still where, to me, the model and the AI work together, where you model the process of how ALS damages the neuron, and how that works in the body and every receptor involved. And then you use the AI to say, how do we stop that? How do we inhibit that? How do we repair that? And you kind of use the two of them together. Maybe wrongfully I'm separating the two, but I have kind of think of them as two different things. That human model, the computer version of the human that they're testing the drug on, kind of. You know?
That's incredible, and that really would be a hopeful thing if we could do that. Big picture, does this mean theoretically that drugs are going to be cheaper, that they're going to be out sooner, that there's going to be more specific drugs?
I think initially no way cheaper, because I think one thing that they definitely mention is they've already invested billions in AI.
Yeah,
so they've got no payoff from the AI. So again, I'm capitalist. You've got to have that financial motive, or people aren't going to be doing this. Who wants, so I do, feel that because I'd mentioned costs going down, I'm definitely talking in the long term.
Long term.
Yeah.
Okay. So if any of these drugs that they're talking about hit the market, don't expect them to be on the cheap side of things. Probably not.
Quite the opposite.
Fair enough.
Yeah, it's easy to say like, oh yeah, if we have these models that can get through 1 billion times the information as this panel of researchers,
Yeah.
like you just by default think, oh yeah, like this is going to require eventually less resources, less people, less staff.
Yeah.
So it is
you don't
like
have to pay health insurance for a computer.
right, true. But then I don't know. I think it'll be interesting, no doubt. I mean, my goodness.
Would you take a drug designed by an AI?
Totally. Yeah. Like I said initially, Dante definitely summed up the latter parts better, but to me, this is all about that initial phase primarily.
Yeah.
And the human testing is going to be done. The FDA approval is still going to be involved, and how it was created has no bearing to me.
So, and I guess part of the punchline here is the average person probably won't have any idea that a drug was produced by an AI unless it's just being trumpeted for the news sake of holy cow, it's the first AI created drug hitting the market.
But I think it is still a good question because that's why I likened it to the shot, because I just still think there's potential for people just to link, oh, this was AI created. Oh, it was
right.
Usually drugs take 8 years. Why was this only 4? That kind of stuff. And then you start to link those two things in your mind, which at the surface level I get, but
yeah, it's rational thinking, but it's not. It's way more complicated than that.
Yeah.
Like 4 versus 8. Like
yes.
It's not apples to apples.
That's not the same thing. Yeah. That makes sense. Well, I guess the big question at this point is, and I want to know, how is the AI going to wipe us out? Because obviously that's going to happen, right?
I want to hear your answer on this.
My answer?
It'll be more interesting than mine, I bet. Because
I think it just takes over all the Teslas and drives them into things.
I think that's where it starts.
I think so. Yeah. No, I don't. I'm not worried about that. Honestly, I'm on the AI maximalist side. I'm not at all worried about AI taking over and killing everybody. I think we're going to be fine.
Yeah. But I do think, just some really smart people do have concerns about it. I mean, Elon Musk is doing
100%. There are concerns.
The Tesla, the whole self-driving is artificial intelligence, learning how to drive with us as people and drivers as kind of, guinea pigs doing it. So it's obvious that he is into AI. ChatGPT and he had some funding involvement, but at the same time, he's cautioning, the manifestations of it.
There are ethical questions, certainly. Yeah. And I think one of the interesting things, I mean, the AI driving thing is a really good example. At some point in time, the AI is going to be good enough that the only threat to the AI drivers is the real drivers. And at some point, you may see human drivers outlawed because the AIs do it better and they don't cause wrecks.
That kind of have thought of things like that. And that's really mind-bending to think about.
It is,
but I can see it going there.
Yeah, and then what happens when somebody hacks the system and now they have control over your car or something like that?
It's wild.
They're not going to create drugs that way though, so it's going to be okay. We're going to be fine. All right, that's it. Anything else? Are you worried about AI, Dante?
I don't know. I've just been thinking about the Westworld setup where you have this place that you can go. You can go there, and it's just then it becomes blurred. And everybody starts doing that, and then that becomes the potential reality. You know what I mean?
Yeah, like they stay in that world.
The internet's already there.
You probably wouldn't want to leave it.
There are some people that have some issues with not wanting to leave their virtual world.
True, it's not that far different. You're right.
The more immersive it becomes, the scarier that is. Don't do that. Go outside, touch some grass. It's a good thing. All of our products, anything we mentioned, I don't know, we probably didn't even mention any products today. Omega Essentials, you should check those out. They're available on our website, www.askjoedematteo.com. That site is also where you can sign up for our email. You can find out what is on sale. You can find out news about this show. You can find classic episodes of the show that started all of this, the Ask Joe DiMatteo show. If you have any questions, email those to us, questions@askjoedematteo.com. Show notes, anything we mentioned, we're going to put all these articles. They're going to be available down in the show notes section of this episode. And if you're only listening, you are missing all of the fun because we're good looking guys and you should check this out.
True.
We're also all married, so it doesn't matter. It's fine. It's fine. Watch the show as video on YouTube or Rumble. They're available there. Anywhere else you could stream audio podcasts, it's all there. Big thanks to Josiah Schweinberg, keeping us looking good. Behind the cameras, Michael Depesh, our editor, Joyce Gibb, our nurse practitioner, who handles private consultations. Diane Silverman manages product. Terry does scheduling. Cecilia does distribution. That's Joey DiMatteo. That's Dante DiMatteo. I'm Tyler Andrews. And now the question is to you. You've heard some things. You've learned a little bit about AI. What are you going to do about it? Are you going to use AI in your life? Are you going to take the drug designed by AI? Thanks, guys. We'll see you soon.